Good afternoon, and welcome to COVID Health Order and Safety Requirements, Risks, and Best Practices for Construction Sites. The meeting is hosted by COVID Health Order Compliance Team in partnership with the Department of Building Inspection, and it is produced by the virtual outreach team of the COVID Command Center. A few housekeeping notes. Today's meeting is being recorded. Today's event is being streamed live on YouTube. We respect all participants in this convening today and want to create a safe space for all. By default, all participants will be muted and video is disabled. Video will be on for speakers only. To participate in chat, please select the chat button at the bottom of your screen. To activate closed caption, select the More or the ... buttons at the bottom of your screen and click Closed Caption. San Francisco is still experiencing a dangerous COVID-19 surge. You can take the following actions in order to save lives. Stay home as much as you can. Avoid gathering with people from outside your household, whether indoors or outdoors. When you must go out, be sure to wear a mask. 1 in 3 people with COVID have no symptoms, but can infect other people without knowing it. If you have been exposed to COVID-19 or have symptoms, follow guidelines about quarantining. Support is available by calling 628-217-6101 or by calling 311. Together, we will recover. This is today's agenda. Introduction and welcome, big picture overview on COVID, overview on infections, risks, and trends on construction sites, DBI inspections and working with DPH, COVID health order compliance, and finally a Q&A and wrap up. And with that, I will turn the meeting over to Patrick O'Riordan, Interim Director of the Department of Building Inspection.
Good afternoon, everybody. My name is Patrick O'Riordan. I'm the Interim Director at the Department of Building Inspection. And I want to thank you all for joining us on this webinar today. We appreciate you taking the time out of your busy schedules for this important information. We are holding this presentation because while we know how important construction is to San Francisco's economy, and especially how important it will be to the city's economic recovery, it must be done in a safe and responsible manner. By and large, all of the building industry have been doing a really good job in following the guidelines and the rules set out by our public health officials. But as we see cases continue to surge throughout the region, we need you to double down on those efforts. As always, our goal at DBI is to ensure that buildings comply with the requirements of the building code. And in addition to that, we are also requiring that you comply with the health order and the health code. You may have noticed some of our inspectors have been providing you with checklists when they observe violations of the health order. This is part of our overall effort to make sure that both builders and relevant city departments have the information they need to ensure that everyone is complying with the health order. Acting Deputy Director Joe Duffy will speak more on this later. Today you will hear from Jonathan Piakis from the Department of Public Health, who will provide you with an update on the current surge of infections. You will hear from Jackie McBride from DPH, who will provide an overview on infections and trends on construction sites. DBI's Acting Deputy Director of Inspection Services, Joe Duffy, will speak about our process for working with DPH. And Peter Keith from our City Attorney's Enforcement Team will speak about some of the potential consequences of non-compliance. And finally, Jennifer Johnson from the city's COVID compliance officer we'll wrap things up and manage the Q&A portion of this webinar. I want to continue to stress to you that we are not looking to punish anybody or shut down jobs. We are here just to achieve code compliance as always. Again, thank you for joining us, and I will turn it over to Jonathan.
All right. Good afternoon, everyone. I'm Jonathan Piakis. I'm with the Department of Public Health. I'm briefly going to go over where we currently stand at the citywide level with COVID-19. DPH remains committed to using a science-based decision-making process to guide us in issuing guidance and policy. A lot of that data is tracked and reviewed for these purposes, and the 5 key public health indicators are amongst the most important that you can see on your screen today. Based on these, based on this data, the indicators are assigned to a color-coded level, ranging from green, which indicates that we are meeting our target goals, to red, which indicates a high alert category. I'm going to quickly go through these indicators and then go into a little more detail with our main health indicator. So our first key health indicator is regarding hospital capacity. There's a couple subcategories within this that we look at. One is the weekly change in COVID positive hospitalizations. We're currently meeting our target goal, and the most up-to-date data shows that over the last 7 days, we only seen a 1% increase, which is good. We also look at acute care and ICU bed availability. That varies a little bit on a day-to-day basis, but we're currently right around 25% for those, which is also meeting the goal. Another category of our key public health indicators that we look at are the number of tests provided per day. Again, this ranges, but we're currently right around 7,000 tests per day, ranges from about 6,000 to 7,000 currently. And again, that is also meeting the goal. Our ability to manage contact tracing is another thing that we look at. We not only look at reaching the positive cases, but reaching the close contacts of those positive cases when they are identified. We're currently at about 80%. That's in the yellow category, which is a low alert category, but we're pretty close to meeting that goal. Another goal that we are meeting is our essential PPE availability. We're currently at 100% for all categories of PPE available in the city. This was an issue more in the early days of the pandemic, but we've since got that to where we are clearly meeting our goal. The last and our main public health indicator that we look at is the number of new cases per 100,000 residents. I'm going to go into a little bit more detail on this one. We're currently, as of today, at 16.8, which is in the red or the high alert category. So looking at that indicator, again, we're at 16.8 and it is in the level 4 red category of high alert. But we are certainly making progress and moving in the right direction with this indicator. The indicator was at an all-time high of 43, as you can see on the image on the left there, and that was on January 8th. So just about a month ago. Over the last month, we've done really, really well to decrease that greatly. And today, again, we're at 16.8. So almost a threefold decrease since early January. That trend is pretty consistent when looking at the graph on the right, and that is the straight average number of cases per day. Again, the peak was on January 8th for this as well, and that was at 373 cases. And we have since decreased that by over 200, where we currently stand with the most recent data available, which was an average of 146 new cases per day. One of the last sets of data that I will mention that you can see on your screen on the bottom there is the percent of positive cases that we see in the city based on local testing. You can basically think of this as essentially a good trend indicator of how much virus is out there in the city in San Francisco. So you can see in the early part of the year, had a peak there at about 5.36%. And we have since decreased that to about 3.16, where we are at currently today. That's a similar trend to what we've seen in the other categories. But we still have a little bit to go to reduce that to the pre-holiday numbers in that metric. So this is all very positive news, but it's important to note that we still have some work to do. Again, our case rate is decreasing, trending in the right direction, but we need to reduce it further. We're still in that level 4 red category, the high alert. But it is important to point out that the health and safety measures that are in place are working, and that's why we're seeing this significant decrease since the early part of the year. So what does this mean for kind of the construction industry and the construction sites in the city, kind of bringing it to a smaller scale picture? This means that we have to continue to maintain all of our health and safety protocol and be diligent with those. So that includes maintaining 6 feet of distance between workers, not only when working on site, but during breaks, lunch breaks, smoke breaks, anything like that. Properly and consistently wearing face coverings, practicing good hand hygiene, completing all of those daily health screenings and staying home if you're experiencing any symptoms and getting tested if needed. And finally, avoiding those higher risk categories like indoor settings with poor ventilation and limited airflow. So that might look like carpooling to work. What we tell our team and our staff over here is bundle up and dress warm and put those windows down as much as possible, because that increase in airflow can have a big difference. So with that, I'll turn it over to Jackie, who will go over some additional information specific to the construction industry.
Good afternoon. So I'm going to be speaking to you from the next slide. So I'm with the San Francisco Department of Public Health Community Branch, and during COVID, we established a workplace hub. And our role is to provide support to the work sites and recommend COVID-19 prevention measures to help maintain the safety of your employees. So when there is a case, you will hear from someone in the workplace hub, and our role is really to support you and to walk you through all the things that you need to do to maintain the safety, how to identify close contacts, how to assess the work environment to make sure that it's safe, and how to confidentially notify people without naming the person who was COVID positive. Next slide. So the reported cases for COVID-19 last week was our lowest that we've seen in a long time. So things, as Jonathan mentioned, are looking up. This is data is for the week of for the month of January. So you've been hearing about a surge. So over the holidays, the first week of January, we had 63 construction cases. Then it went to 68. And the third week, it dropped to 67. And last week, it was 21 cases. So things are definitely getting better. But we can't, get complacent, and we need to continue doing whatever you're doing, keep it up, because things are looking better. And we have the big Super Bowl this weekend, and we are hoping that people try to maintain physical distance and wear their masks when they're celebrating, and hopefully they won't gather in large groups, because we will see a surge, within the next 2 weeks as a result of Super Bowl. So I don't know if there's still time to talk to your staff before they get off today. about trying not to gather in large groups, that would be helpful. Next slide. And this is just a slide that's talking about construction sites by trades. And we're noticing that recently general construction, we're seeing cases, electrical, drywall, unknown is when I didn't mention it, HVAC, architectural. So our highest cases we've been seeing most consistently have been general construction. So that's just around the general construction site, and electrical and drywall. But there has been, cases in all the rest of them, as you'll see: locksmith, floor tiling, painter, steel, carpenter, plumber. It's less and less. And we believe that some of this is contributing to working in close quarters together, or too many people on one floor working together. The physical distance makes a difference, and it causes more people to transmit COVID when you're working close together. So we'd like you to really think about not having too many people at the work site in close quarters together. Next slide. This is just a nice, colorful slide of the COVID cases by construction trades. So you'll see the large piece, this is a pie chart. The large pieces of the pie is general construction, again, as I mentioned, 19%, electrical is 18% of the cases, drywall is 11%, other, and then HVAC is 19%, and architectural 6%, and others. Next slide. So as I mentioned, one of the major things that we do when we call you on the phone, when there are clusters, we have sometimes an hour-long conversation with your health and safety manager. But COVID is preventable, and we do want you to wear a face covering over your nose and mouth all day at the work site. Stay 6 feet apart from others at the job site while working, during breaks and during lunch. Wash your hands frequently. Ask employees to please stay home if they're sick, even if it's mild symptoms like a headache. A headache used to be a headache, but now during COVID, it's one of the major symptoms of COVID. If employees must carpool, we recommend that everyone wear a mask the entire trip, as Jonathan mentioned. Ventilate the car, roll the windows down, wear your coat while you're riding. It definitely makes a difference. Next slide. Another preventive measures to limit the number of employees on the same floor or working in close quarters. Conduct morning huddles to reinforce health and safety messaging. If you get reports of employees who test positive for COVID, consider increasing and modifying your health and safety measures. Think about doing something different. If you come to work on Monday and you get a report that there's 4 cases at your job site, rethink what after you talk to the staff about what happened, but rethink and look at what is it that you can possibly do different to not have any more cases at your job site. Conduct daily health screenings. I cannot stress that enough, because people do show up sometimes with a fever or they're not feeling well, and they will come to work. So conducting the daily health screening is really, it's very important. And also I think it's part of the compliance health order. And I would like to advise you to please create a culture of safety. Let the employees know that you really care about them. You don't want them to get COVID. You don't want to get COVID. And whether it's a larger job or small job site, you want to encourage staff to follow the safety precautions on and off the job so that they can protect one another and their families, as well as their coworkers. Next slide. And if you have any symptoms and get exposed, isolate and quarantine. they test positive, it's important for them to stay at home. I'm not sure if everybody knows that. And so it's not just having 14 days off like vacation time. Explain to staff that they really should stay home and not be around other people. And if anybody in their family has it, it's just the same as they have it. They need to stay at home for 14 days and not be around others. Encourage everyone to stagger their lunchtime, refrain from smoking breaks and hanging out together. We'd like you to continue. You're doing a great job reporting. I know it's part of the compliance health order, but continue to report positive cases and close contacts and inform the staff to stay home in quarantine. It helps to prevent additional cases at your work site when close contacts are informed. And clean off and sanitize and disinfect high touch areas often, as much as you can during the workday. And lastly, we really appreciate you doing a great job reporting the cases and contacts to us. Don't hesitate to reach out to us for guidance, for additional prevention assistance. As you see, 21 cases, we are so excited because we work 7 days a week handling the cases. And we had a little bit less to do last week, and hopefully it'll continue the same. And our workplace sites at sfdph.org is our email where you can contact us for any questions that you have. Thank you.
Nick, could you put up the next slide? I think Jackie is.
Next we have.
Thank you.
Good afternoon, everyone. This is Joe Duffy, Acting Chief Building Inspector and Deputy Director for Inspection Services at DBI. Thanks for going on our call here and our meeting today. First off, I just want to thank all the contractors and the workers out there for cooperating with us. Our inspectors have been, for the past few months, have been involved with the program with the health department, city administrator, and city attorney's office. And again, I just want to thank you for your cooperation. Next slide, Nick. DBI's role in the COVID health order compliance, I'll just go over that. Our goal is to ensure the safety of the contractors, the workers, the public, and DBI employees. In order to ensure that contractors continue to comply with the health order, DBI inspectors are distributing information about the requirements, documenting non-compliance, and providing information to the Department of Public Health. You may have seen our inspectors, if they do see any shortfalls in the health order protocols, they will document it on a checklist, leave it at the job site, and then we save a copy of that as well, and we pass that along to the city attorney's office on a weekly basis. So the checklist basically will tell you what the inspector has noted to be missing or that he feels wasn't in compliance. Next slide, Nick. Our building inspectors, plumbing and electrical inspectors are checking for compliance for the following requirements: proper mask wearing, construction site screening protocols, social distancing, posting of required signage, providing hand washing stations or facilities for workers, and other requirements as outlined in the health order. As you heard the other speakers mention, the construction site screening protocols are very, very important. Obviously, you don't want to people need to be screened before they go onto the site, because that will help, that's what spreads it. So one of the things I think that on our meetings is that the screening protocols, we want to emphasize that. The social distancing, in the health order, it does require that the work should be scheduled between the different trades and subcontractors so that we don't see overcrowding, particularly on the big sites. We are noticing, if you did notice the numbers with the drywallers and the electricians, that's telling us obviously that when the sites are closed in, there's going to be a higher rate. And that kind of makes sense. But what that should also say as well is try to keep people separated as much as you can. We all realize that there's timelines on these projects and there's scheduling, but we're in a pandemic. We need to be thinking of that. And I know it's, as I say, the numbers are coming down. One of my fears would be that we will get loose on that, and we'll drop our guard and we'll be back up again. So we're going in a good direction. But again, emphasizing that the social distancing, the man lifts on the projects as well. I know some of the sites have good practices in place, but we don't want to be increasing the numbers in the lifts. That's going to put people together closer as well. So just want to emphasize on that. Next slide, Nick. Again, just if we do observe failure to comply with any of the requirements with the order, DBI will report the issues to the city attorney's code enforcement team. And the inspector always has the right to reserve and cancel the inspection. We have done that on a couple of smaller projects. The inspectors do not feel comfortable going to the site. So, we do need, that hasn't happened a lot, but it does, we have the right to do it. And as well as that, again, if we do see repeated cases of the non-compliance, we will refer them to the city attorney. So thank you. Nick, any more? So again, this is a checklist for the that's in the health order, and the health order since last April has been updated on a regular basis. And these the checklist is so important. It needs to be it's got to be on the project. And as you can see there, it's got a lot of information: type of project name, address. The small construction projects are a little different than the large ones. They do have requirements. Nonetheless, we are looking for some contact information. The larger contract construction projects do have JAS officers, and that's really important, and it's been working out well. But again, all of that information does need to be out there. And the signage as well, again, having more signage makes people more aware, and will keep their attention on this as we do move through the next few months. So just having that at all required places is very important as well. And again, the screening, again, I will say it, but it is very important. And I think that's it for me. If anyone has any questions at the end, thank you.
Great. Thank you, Joe. Nick, do you want to put up the next speaker? Thank you. Great.
Good afternoon, everyone. I'm Peter Keith. I'm with the City Attorney's Office. I'm the head of the office's code enforcement team, and in regular times we work very closely with the Department of Building Inspection to make sure that all the building code and housing code issues get complied with. And likewise, we work with the Department of Public Health just on their regular public health regulatory duties. In this COVID epidemic, our office is certainly shifted its resources, as have DBI and the Department of Public Health. We're really very focused on the on COVID-19 and taking measures to prevent the spread. In terms of our role, we help different city agencies coordinate their response to COVID, and we advise them on the steps that they can take to get compliance, both on what are the rules that need to be complied with, and how we can get sites into compliance. And I think as all the speakers have emphasized throughout this call, our goal is to keep people safe. We're not looking to punish, we're not looking to make a statement. We just want safe conditions on the site so the spread of this terrible disease can be slowed down. So what I'd like to do is start by showing my first slide here, which is some of the resources that you can look to know what your obligations are with regard to COVID health and safety measures. And I believe these slides are going to be made available afterwards, and hopefully it'll preserve the hyperlinks that we have here. So the first authority that I want to point you to is Cal OSHA. They have what they call construction industry guidance. And well, it's not just guidance, it's the rules, it's what you need to do. So I recommend, if you haven't already looked at this, look at this now. And then next, you'll want to go to the sfdph.org website. That's the Department of Public Health website. If you go and if you just remember that one web address, sfdph.org, you will be able to find everything you need. You go there and you click on coronavirus, and it'll take you to a page that gives you orders for every industry, directives for every industry that you'll need to look at, including construction. And some of the key documents you'll want to see are the health order itself. See the current version. We're already up to letter S. So as Joe mentioned, we've gone through a lot of iterations of this health order. That's the most recent one. Joe showed you the first page of Appendix B. That's where you'll find the specific guidance that you have to follow at your work sites. Now, part of that is a checklist, and it's not just a matter of posting the checklist, it's doing everything that's listed in that checklist. It's a few pages long, and it includes some of those requirements, it includes all of those requirements that the various speakers have been highlighting. Things like face covering compliance, things like staggering the work so that people can remain properly spaced. As the numbers show us, it's when too many people get into a space that is not well ventilated that we see spread, and those trades are suffering, and those people and families are suffering as a result. So if you have to change the deadlines on your job in order to meet these health order obligations, then you're going to have to take that step. And so I advise everybody to really take these measures seriously. They do have the force of law. And then we've talked a lot about personnel screening. There's forms that have been prepared by the Department of Public Health that are on the website. Appendix A1, this is for people who are coming to the job sites to do work. There's a personnel daily screening handout, English, Spanish, Filipino, Chinese, all sorts of languages. And those contain all the questions, do you have these symptoms? Have you been in close contact? And everybody's got it, if the answer to any of these questions on this list is yes, people need to stay home. And we have to, as Jackie mentioned, we need a culture of safety at workspaces. This is not the time to shrug off, I just have the sniffles, I can still work. Not now. You're putting the safety of everyone at that work site in danger. And and as work sites that have had clusters have known, if you have a cluster, you've got to shut down and clean the site up. I mean, that's going to stop work. So, again, this is, dollars and cents is one thing. People's health is another, but both things are going to suffer if you don't take proper steps to protect the safety of your work site. And then Appendix A2, that's a screening handout. And this, again, is one of the things that Joe's inspectors are going to be checking for. That is something that people who visit your site, say just to deliver materials, they've got to be able to answer that, or they can't enter the site. And again, it's a slightly less, I'm going to say slightly less onerous list of questions they have to answer, but they still need to answer those. And so again, you don't want people coming onto the job site and who may be infected. Again, as we heard, 1 out of 3 people are asymptomatic. They don't know. And so, you really need to make sure that people are asking, maybe, if they've been in contact with somebody at home who has COVID, even if they feel fine, they need to stay home. So anyway, this is, these are all serious requirements. They all have the force of law. Health officer, one of the things our office does is advise the health officer on the scope of their powers under state law. And they are, this is an emergency and the powers match that. And, it's very important that we all comply because the consequences can be serious health-wise if you don't, and then legally they can be serious. So let me ask if we can go to the next slide. So again, this is the language from the health order about, again, going back to those emergency powers that I just referred to that the health officer has. Put bluntly, if we see, if Department of Building Inspection, Department of Public Health observe non-compliance at a site and they don't see it promptly corrected, you could face a shutdown. You could be ordered by the Department of Public Health to shut your site down. This is a power that the health officer has used for many businesses like restaurants or bars that aren't following the health order. Over the course of the pandemic, we have not yet had to use it at construction sites, but if the case comes along where where the health officer deems it necessary to protect the health of workers and protect public health, they will do it. And again, our goal here, again, is not to punish anybody. We're not looking to shut anybody down, but we're really in an extraordinary time, and the public, when the public health is at risk, the city does have to take steps to protect it. So everybody, I encourage you, be safe. And the advice that was given by Jackie and Joe and Jonathan regarding best practices, I mean, there's not a lot you have to remember, but you and your workforce have to do it. So thank you.
Thank you, Peter. Nick, did you want to put up the next screen, please? Okay. Great. Thank you. Thank you to everybody who's attending and your interest in, making sure that we keep everybody safe and ourselves safe, and that we follow health order rules. I won't go over what everybody else has said, but ad nauseum, but really it's important that we follow those rules to make sure that we can continue working. Our goal is to support you. It's not to shut anything down, but we need your help in doing that. And that does mean, staggering shifts, making sure there aren't a lot of people on at the same time, posting the required, signage, and then also making sure people are, exercising good hygiene and care. I should say, sorry, Jennifer Johnston, Deputy City Administrator, my daytime job, and then I'm also the city's COVID compliance officer. And so what that means is just making sure you have the information and resources necessary to be able to comply with the health order, including having town halls like this, which is being recorded. And so that'll be available on the DBI website. We'll provide information later on that. Nick, did you want to move to the next slide, which has, there we go. Okay. So why don't we go ahead and start with a Q&A portion of this presentation. In the meantime, you can see there that we have posted for you additional information or resources. I strongly urge you, the slide that Peter provided you is very, has the highest level important ones you need to focus on, but general questions, general information are also available there. And additional questions after this, or for those of you that are in the waiting room, you can direct them to the website dbi.covid19 safety plans at sfgov.org. So why don't we go ahead and move into the question and answer portion of this? I don't know, Nick, if I can see those. See my mouse.
It should be in the chat. So you should be able
to
if you
in
open
the chat. I see. Perfect. Great. Thank you. Okay. Let's see. So questions, new cases per day. I believe Jonathan answered how many new cases per day. And as Jackie indicated, those numbers have, oh, Peter Keith is already, okay. Sorry about that. Okay, I don't have any other, are there any updates on the FFCRA for employers? I should say, it has become mandatory. I won't be able to, or we here won't be able to respond to questions about any federal assistance programs or vaccinations, which I know are very critical, high level question for everybody. So vaccinations, testing, and any federal, state, or local assistance programs, we will not be able to answer, but to the extent we have resources on that, we'll post that on the DBI website. Let's see, guidelines for sanitizing stations where running water isn't available. Jackie, do you have any thoughts on that, sanitizing stations? Actually, does not OSHA require there to have at least water available? I believe that's the case, but Jackie, do you have any thoughts, or Jonathan, or is that something we'd have to get back on people for the answer for sanitizing stations where there isn't running water available?
I would recommend sanitized wipes if you don't have running water, just large amounts of sanitized wipes, which will be a lot of garbage that you'll have to end up dealing with. But yeah, if there's some way that you can have water available, that would be helpful.
Okay. Let's see. So is Appendix B2 for large construction sites which require a JSAS something required by the state and or OSHA, or is it just county by county? I believe that's required specific. I can't speak to what other counties, and Peter, please let me know if I'm incorrect on this. I don't know what other counties provide. But I know that the health order is specific to San Francisco, and it does govern and is the guiding authority for San Francisco. So by virtue of the health order, you are mandated to comply with those requirements, including the JSAS mandate. I will say also Appendix B2, we have, as indicated, we've amended it at numerous times. And now we've consolidated the two, Appendix B1 and Appendix B2, to make it easier for construction sites to be able to follow the guidelines. So please do make sure you take a look at the new updated version. Okay, from Chris Brown, small sites drinking water is required, but we don't have drains. Okay, I guess then to Jackie's point, making sure that you have sufficient amounts of sanitizer, hand sanitizer, and sanitizing wipes is required. Let's see. One other thing I'd actually like to mention, and I'd like to thank another partner in this, is the Building Trades Council, who has really been partnering with us, looking at the numbers and strategizing on ways they can support us. And so to the extent of staggering shifts, they hopefully, the Building Trades Council business representatives can also help assist and guide people and help you find resources to make sure that you are complying with health order requirements to keep them safe. So question from Rudy Gonzalez. It appears that the new orders no longer require reporting new cases, only outbreaks, clusters of 3 or more. Is that intentional or correct? Peter, did you want to speak to that?
I think Jackie is more familiar with the reporting requirements for work sites.
Jackie? I don't recall us, it used to be the case that each outbreak would be required to be reported. So I think the clusters are for other industries, but Jackie, did you want to speak to that?
So I know that it says only clusters, oops, sorry. Hi, I know that it says only clusters, and I'm not sure if it was unintentionally left out. But we do get, reported cases. We get your cases every day, but I do believe that that's what it says, but I'm not sure if that's what was intended.
Yeah, Rudy, that's a good question. I didn't catch that. So I will go back and take a look at that. The intent was not to change that. We do need to make sure that we are on top of the infections. Because as has been indicated, those are, very high number of infections, greater than any other workplace sector. And so we'll be getting back to you on that. Thank you. Let's see, from Timothy Jeffries, in the graph for construction, there was a selection labeled unknown. Can someone explain who makes up the unknown? So Jackie, if you want to speak to that, but I believe it's those that individuals that don't provide necessarily or haven't provided for one reason or another, the specific industry in which or trade that they are performing. Is that right, Jackie?
That is correct. Yeah.
Okay. Yeah. And is that, Jackie, because they just decline to provide that information, or because they're more general? Well, I guess that'd be under general, but that's just because they don't specify.
Yeah, they just did not specify.
Okay.
And we do try to follow up as much as possible to try to get the details of it. But like I said, last week was the first week that we were not swamped. But, to call every single, because it's a 7-day-a-week operation, that we try to talk to you, all of your safety officers, to talk about the details and get into the nitty-gritty of what's going on at the site and try to give you ideas to mitigate it. So we're working on trying to reduce that number of the unknown. Thank you.
Okay. And I think for clarification purposes, it looks like there may be some question about AB 685, trying to reconcile that with our health orders. So I wasn't aware that there was a potential conflict. So I will be looking at that today and hopefully be able to provide a response to all the attendees of this meeting. We'll go ahead and send out an email with clarification on that and post that information on the DBI website. So thank you for bringing that to our attention, and we'll make sure that we clarify that question for everybody to make sure that everybody's understanding with what applicable requirements are in place. So thank you for flagging that to Rudy and Carpenters and the Building Trades Council. Anything else? Okay. I will give you back the gift of time. Should you have any other questions, again, you can feel free to email the DBI website. You can email me directly, jennifer.johnston@sfgov.org. If you have questions, sorry, Rudy, but you can also relay questions to Rudy, the Building Trades. Like I said, we partner weekly. And so any specific additional questions you have, he does relay them to us for to coordinate response. And then the DBI website is dbi.covid19safetyplans@sfgov.org. This video will be posted on the DBI website, and I do intend to send a follow-up email again to all of the attendees with a response to the questions to reconcile the state and local law, and then also with the resources that we are providing here and location at where those can be posted or where questions can be directed. All right. Okay. Thank you all. Be safe, please. Again, Super Bowl, as Jackie has already said, frankly, we're bracing for another surge. Please don't make that, please make that an erring on the side of caution and not an actual reality. Be safe, keep your distance, masks on, avoid crowds and get-togethers if you can. You never know who has COVID. It's, a majority of the people who have it and are infectious don't even know it. So please be careful. Thank you. Oh, can you send a copy of the graphs? Yes, we will be posting, and additionally, we'll be posting the slides. We'll be doing that, Roberto. Thank you. So Nick will be, okay.